I'm going to perform midstream sample of urine collection and urinalysis. So first, I'm going to make sure that the scene is safe. After that one, I'm going to perform hand washing in accordance with the WHO guidelines and adhering to the 5 moments. So now I'm going to perform hand washing for 20 to 30 seconds by getting an ample amount of the product in my hand. Start rubbing palm to palm. Back of my hands with my fingers interlace. Vice versa. Palm to palm with my fingers interlace. Back of my fingers with my fingers interlocked. Rotational rubbing of the tips of my fingers against my palm. Vice versa. Rotational rubbing of the thumbs and wrists. Once my hands are dry, I can now approach my patient in a calm and professional manner. So I'm going to approach the patient, introduce myself, provide privacy, and do an identity check by asking the patient name, date of birth, and hospital number, simultaneously checking the wristband and the record, and asking for the allergies. I'm also going to gain the consent of the patient, and now I'm going to start with the explanation of the procedure. So, hello, what do you want to be called?
You can call me Catherine.
So, Catherine, my name is Christian. The reason I am here is I'm going to do a procedure called your midstream sample of urine collection and urinalysis. So, this procedure is done for us to check if there are any signs of infection or any abnormalities in your urine. This procedure involves me taking a sample from you, which is your urine. And before we do that one, I'm going to ask you to go to the toilet and make sure to wash your hands. And I'm going to ask you to clean your genitals by parting your labia and cleaning your genitals from front to back using a soap and water and pat drying it with paper towel. Is that okay with you?
Yeah, that's fine.
For you to catch your sample, which is your urine, I'm going to provide you a specimen bottle. And what you should do is catch your urine in a midstream manner. So for you to do that one, once you are already seated on the toilet, and once you've started voiding or urinating, you could probably count 1 to 3 seconds. Once you've reached the 4, 5, and 6 seconds, you could use the cup I'm going to give you and catch the urine in the middle part up until you've filled out the specimen bottle or the cup that I'm going to provide you. And the remaining or the rest of your urine, you can void it on the toilet. Is that clear with you?
Yeah, that's clear.
Do you want me to repeat the instructions?
No, that's fine.
Lovely. So, is this a convenient time for us to do it?
Yes, it is.
And are you happy for me to do it?
Yes.
Okay, so if that's the case, I'll just prepare my materials. I'm leaving you this call bell. If you need me, just press it. So I will be here to assist you, okay?
Yes, thank you.
Right, so now I'm going to prepare my materials. I'm going to start off with my hand gel. I'm going to use a kidney basin or a tray, making sure it is clean, dry, intact, or has been disinfected for the last 24 hours. Assessor, is this safe for me to use?
Clean and safe to use.
Okay, so I'm also going to use a specimen pot, making sure it is clean, dry, intact, and from a box that is not yet expired. So, assessor, is this safe for me to use?
Clean and safe to use.
And lastly, my multi-sticks bottle, making sure it is clean, dry, intact, and not past expiry date of 2022. So, safe for me to use. I also have my multi-sticks report form and my fob watch. Now, I'm going to do a quick hand rub and go back to my patient's bedside. I've got here this sample bottle or sample pot. I'm just going to leave you with this one, and I need you to go to the loo, and once you're back, I will just collect it from you, okay?
Alright then.
Okay, so now leaving the specimen pot, and while waiting for the sample, I'm just going to start putting on my apron and gloves. My hand gel and my apron. Making sure that when I put it on, the inside part is facing the patient. Now I'm ready to go back to my patient. So Catherine, I am back. So I've got here your sample. Do you mind just confirming me your name and date of birth?
Yes, it's Catherine Miles, 3rd of 11th, 1980.
And can I just confirm that you've collected this midstream?
Yes, it is.
Okay, so just give me a minute. I'll just do your urinalysis, okay?
Alright.
Okay, so now I'm going to start off with opening the sample bottle. I'm going to get one strip from the multi-sticks bottle and make sure to close it at once. And I'm going to make sure to dip the multi-sticks into the specimen for not more than 1 second. Now I'm going to hold it at an angle at the edge of the container and start counting 30 seconds for glucose. So 1, 2, 3, 25, 26, 27, 28, 29, 30. Glucose is 2 plus. Another 10 seconds for ketones. 1, 2, 3, 9, 10. Ketones is negative. 5 seconds for specific gravity. 1, 2, 3, 4, 5. Specific gravity is 1.030. Another 15 seconds for blood. 1, 2, 3, 4, 11, 12, 13, 14, 15. Blood is negative. pH is 5. Protein is negative. Nitrates is negative. And another 1 full minutes for leukocytes. 1, 2, 3, 4, 55, 56, 57, 58, 59, 60. Leukocytes is negative. So now I can dispose this one to the clinical waste bin. Quickly close this specimen bottle and make sure to take off my gloves one at a time and dispose it to the clinical waste bin. Do a quick hand rub and start documenting my results. So glucose is 2 positive. Ketones is negative. Specific gravity is 1.030, negative for blood. pH is 5, protein, nitrate, and leukocytes is negative. Okay, do a quick hand rub. Okay, so now Catherine, I've got here the results for your urinalysis. So based on your sample or urine, you've got 2 positive glucose in your urine and your specific gravity is 1.030. So what we're going to do is I'm going to escalate these results to your doctor and see if they will be updating your care plan. But for the meantime, what I need you to do is increase your fluid intake. If you could cut down your sugar and carbohydrates intake, do proper exercises if tolerated, and maintain your hygiene. Okay, so Catherine, have you got any questions for me?
No, I'm good, thank you.
Okay, I'm just going to do my aftercare. You've still got your call bell beside you. Press it if you need any assistance. Quick hand rub and don a new pair of gloves. And make sure to dispose the specimen to the clinical waste bin or set it aside as per hospital policy if the doctor wants to do another test on it. The multisticks will be placed back to the cupboard or as per manufacturer's policy, and tray will be cleaned and disinfected for the next use. Now my apron and gloves will be disposed to the clinical waste bin, and now I'm going to do my final documentation and final hand washing.